Hi everyone, it's Dr. Claudia Muñoz here again. I'm super happy to be with you today. We're going to talk about my favorite topic of neurology, which is epilepsy. As some of you know, I'm a trained epileptologist, and it's a condition that is near and dear to my heart. So let's get started. First, let's start with the real basics. What is epilepsy? Let's look at this together. Okay, I'm just going to read straight off here. An epileptic seizure is a transient occurrence of signs and/or symptoms due to abnormal, excessive, or synchronous neuronal activity of the brain. Epilepsy is a disorder of the brain characterized by an enduring predisposition to generate epileptic seizures and by the neurobiologic, cognitive, psychological, and social consequences of this condition. What does that even mean, right? It's a lot of big words. So what's a seizure? Seizure is symptoms. There's shaking, staring, twitching, any variety of symptoms that are caused by the misfiring of the neurons in the brain, okay? Epilepsy is a propensity to misfire, these neurons misfiring, and all the associated consequences for a person's health and their life. So when you say someone has epilepsy, don't think, oh, it shouldn't be that terrible. They're just having these spells and that's it. No, these seizures and the condition of epilepsy is life-altering. So let's talk about this some more. Comorbidities, that's the fancy big word for conditions that can occur with or because of epilepsy. So people with this condition often have a lot of anxiety, depression. They can also have migraines. Certain mental health conditions also tend to correlate with epilepsy. Sleep disorders, so epilepsy, seizures can really disrupt sleep. And there's a condition that we'll talk about a little bit more, sudden death in epilepsy. So you think, why are these conditions comorbid? So think about it. If you had a propensity to potentially have spells or episodes where you lose consciousness or your consciousness is altered, you have no warning that they're coming, they happen anytime, night or day, and they leave you afterwards not feeling yourself, that can be very anxiety producing. Also, there's chemicals in your brain that get released during these episodes, and they can change your overall brain chemistry. So that can lead to anxiety, depression, and again, there's a sea of comorbidities and processes that happen that we don't even fully understand yet at this point in our history. So I'm just trying to drive home the point that, again, this condition is a whole condition that affects this person and not just a set of symptoms. So I mentioned SUDEP, sudden death in epilepsy. It's an unexpected death in patients with epilepsy, and it's just something that people are sometimes reticent to talk about because it's scary. I personally don't like just kind of springing this on my patients. I don't like scaring people, but it's something that we really do need to talk about. Anybody with epilepsy out there, you need to know about this. And you need to talk to your doctor about your potential risks for SUDEP. So who particularly is at risk? People who have poorly controlled seizures and people who have a tendency to the generalized tonic-clonic seizures. So these are the seizures that affect your whole body with shaking, loss of consciousness, and those can become prolonged. So those are the biggest risk factors for SUDEP. So we're going to go back to just plain old seizures now. I just wanted to talk about that subject for a second, but now in general, seizures of any type, they can cause different things to happen in your body as they are happening, and then also afterwards and just in general. But as they're happening, seizures can cause injury. If you are somebody who loses consciousness with your seizures. You can fall, you can really injure yourself. I've had many patients with epilepsy who come in, they've had a pretty bad seizure, they lose consciousness, and they fall and they hit their head, and it leads to, you know, any number of serious injuries. Also, if something happens to you while you're cooking outside at the grill barbecuing, you can suffer some very, very serious burns. And as you know, burns are painful, they can be life-altering, and if they're bad enough, obviously lead to a lot of consequences down the line. When you're having a seizure, sometimes under certain circumstances, you're not breathing regularly, or you stop breathing completely. And depending on how long this goes on, you're just not getting enough oxygen. And that obviously, for many reasons, is undesirable. Your heart, certain epileptic seizure types can affect the heart regulation. So your heart can become irregular in its heart beating. It can go too fast, and it can go too slow, and it actually stop in some cases, in some very specific types of epilepsy. So again, if you or somebody that you care for has epilepsy, it's really, really important to work a lot with your doctor to try to achieve the best control possible. So, when do I need to see a doctor, you ask? I've had epilepsy for years, or my mom has it and she seems to be fine, or she just has a couple seizures every year, or, you know, whatever your circumstances are. These are just some ideas for you, some suggestions to prompt you to seek help with your doctor, okay, when you may need to revisit your epilepsy control, or just ask questions. You know, it's okay. We're here for that. And somebody like me who loves, you know, talking about epilepsy, I love answering questions. So, when do I need to see a doctor? For example, I'm having weird spells. Could these be seizures? I don't know. And maybe your doctor won't know, but there's tests that we can run, and there's different questions that I would ask you to try to help tease this out. There's many different kinds of spells. That's why I call them spells. I don't necessarily jump to using the word seizure, that can look like seizures, make you think they might be seizures, and they're not. There's something else that we need to treat. Or they may be a new type of seizure that has developed in your brain. So something that your doctor can help you figure out. I have epilepsy and need to be seen at least once a year. I strongly recommend that you, if you have seizures, history of seizures, if you are an epileptic, that you visit with your neurologist at least once a year, even if you are perfectly well controlled, just once a year, just to make sure everything is okay, you touch base, and you still maintain that established care. Because you never know when you're going to need to, when something changes, and it's really good to have a doctor who has a historical documentation of what medicines you've been on, how well you've been controlled on those medications, okay? So very, very important. I have an increase in the number of seizures I'm having. People change, our bodies change, brains change, so you may have, something may have happened, and maybe you just need a medication adjustment. Maybe you need more testing. These are questions to talk about with your doctor, okay? I am having medication side effects and I want to talk about it. This is a perfectly valid reason to come in and talk to your doctor. Even if your seizures are really well controlled, if your side effects are impeding you kind of, you know, going about your life, if they're causing you distress, come in, talk about it with your doctor. There may be alternatives for you, and it's just really important to talk about it, ease your own mind. Maybe it's not your seizure medications, maybe it's something else. But these, again, you and your doctor, your neurologist, can help figure this out. I am pregnant, or I want to be pregnant. There's issues surrounding pregnancy, fertility, birth, all these different things. If you are someone who becomes pregnant in surprise, these things happen, and you're taking medication, or you want to stop taking your medication, never stop taking your medication just without talking to your doctor, please. It's extremely important. We'll talk a little bit more about pregnancy and various issues surrounding women with epilepsy in a little bit. And in the future, maybe I'll do a longer talk about it. But for now, please come in and see us. Okay. Next question. I have epilepsy and have questions about fertility or heredity. So men and women, very, very important questions to ask. It's not just the ladies who may pass on some risk factor to a fetus. Dads or potential dads with epilepsy, I think it's really important to come in and talk to a doctor just to get some questions answered. If you need referrals to a genetics counselor, we're a good place to start for that, okay? And how about just, I'm having a tough time. Like I said, epilepsy is a condition of the whole person, and sometimes it can get to you. And like I said, you can have anxiety, you can have depression. If you are just having a tough time, come in and talk to us. There's resources we can hook you up with. And sometimes just talking about it kind of puts things in a better perspective. So please don't be shy, okay? And in the big letters down at the bottom, don't delay care, please. We're here, okay? This is what we do. And I just hate to see people delay and then come in and something bad has happened. So there you have, that's my pitch. Don't delay care. So you say, I made my appointment. Now, how do you prepare for your doctor's appointments? This I cannot stress enough, okay? These, print out this sheet and keep it for your doctor's appointments. Not just your specialist appointments. This is important for your primary care doctor too, to know. Don't leave that person who's the bedrock of care in our country out of the loop, okay? So you need a list of all of your medications that you are taking, along with doses and your schedule. So don't just say, oh, I take a water pill. No, I want to know the name of that pill, what milligrams that pill is, how many pills you are taking, and at what times. Descriptions of your types of seizures or spells. So don't just say I'm feeling, whatever, I'm having more seizures. Okay, well, what is actually happening? What are you feeling? Just write it down. Keep some sort of like a diary or a calendar. I'm going to show you some examples to tell you, so that you get an idea of what I'm talking about. But details are key very often in figuring out what exactly is going on. Triggers in the spell diary or seizure diary, I want you to kind of figure out, what may have triggered this spell. Did I miss meals? Did I exercise extra hard, which exercise is absolutely allowed and encouraged, but you must stay hydrated. So let's say you went out, it's summertime, you exercised for an hour, you're feeling great, but you did not take enough water with you, you're, skip breakfast or, whatever it is, that may have been a trigger for you. So, and then take written questions, prepare, kind of do a little bit of your homework before you come and see us. And that way you really get, what we call, bang for your buck. Then this visit is really high yield for you. So here's my example. So up-to-date list of your medications, okay? For example, I take carbamazepine. My tablets are 200 milligram tablets. I take 2 pills of those twice a day. So in the morning right after breakfast and at night right after dinner, or whenever it is, but take them twice a day. I take citalopram. That's an anti-anxiety or an antidepressant medication. 10 milligrams, I take 2 of those, so I take 20 milligrams in the morning. Levetiracetam, a lot of us know that as Keppra. I take Keppra, my pills are 500 milligrams, I take 1 pill in the morning and 2 pills in the evening. So this is what's really helpful. It's helpful for you to carry this in your wallet. Give it to your loved ones or your caretaker or somebody. Like for me, my person that knows everything about me is my sister. And she just has everything, right? You need that go-to person and make sure that contact person is with your primary care doctor, whatever your health system is. Make sure that they know who your emergency contacts are. And if you just can't, if this is too overwhelming for you or you have difficulty concentrating, ask somebody to help you to do this, or always just bring in your pill bottles. Now, bring in your pill bottles, but make sure it's the ones that, well, you can bring them all in. But sometimes people get a bit confused and they will bring in the pill bottles of every medication they've ever taken in their life. So really important, have somebody help you figure out what is it that you are taking now so that we can focus on that, okay? Now, what do I mean by a description? These are just some, and these are pulled from patients. These are, I've gone through notes, as I'm reviewing patients, and so I pulled these examples. These are actually things that patients are describing. So, first one, I have a really funny feeling in my stomach, and then there's tingling in my right arm, and then I don't know, I blank out. After that, family just says I blank out for a while, and then I'm back. I'm a little confused, and I'm back. Okay. Next example. The second patient is completely amnestic to their spells. So they don't remember anything. There's no warning. So they're unable to give any kind of description. But they've asked their parents. They live at home still. And, my parents tell me I stare off and I don't answer them. Sometimes I move my mouth and I drool. So that's very valuable information to me, right? And then the next kind is, it's important to know, this is a very important point, you can have different types of seizures, different types of spells in one person. They may mean something different, who knows? But again, description is very important. So I have two kinds of seizures. In the small seizures, I just stare and my left arm shakes. Other times, this left arm shaking gets bigger and then my whole body goes into a seizure. I lose consciousness. My, family says I bite my tongue, all these things. So these are really important. So if you yourself don't know, ask family, what is it that you see happening when I have these spells? Write that down. And like I said, if you have a hard time describing, ask for help. Ask somebody to help you who's around you, who has seen these spells. So this is a spell diary. Very simple. You can just write down the date, keep a notebook, just write down the date. April 2nd, I had a small seizure in the morning. April 10th, I woke up feeling like I had a seizure. My bed was wet. Small seizure around lunchtime, and then, I forgot to take my medication in the morning. This is so valuable for you to give to your doctor. Because it's data that we take into consideration when we're going to try to figure out, are we going to increase your medication, decrease your medication? Are we going to change your medication altogether? Are we going to do more testing? It may not seem, like big pieces of information to you, but to us it's very valuable. And then if what's easier for you is to keep calendars instead of doing a notebook format, the same exact information from here, I put it here in another format, right? So if this is easier for you, perfect. Get one of those little pocket calendars and just write in there, small seizure in the morning, April 2nd. Question mark on the 10th, did I have a seizure? I woke up, felt not good, felt unwell, and my bed was wet. And then skipped my meds in the AM on the, the 18th. And then I had a seizure in the evening. So very important, super simple, okay, but very helpful. This is high yield stuff. So then triggers. This is just general, very well documented, known seizure triggers that I'm going to tell you about so that you keep them in mind, okay? Dehydration, very important. Missed meals. You don't have to eat a lot, but be regular. So try to keep the same meal schedule every day, whatever it is for you. For example, I don't get hungry in the morning until about 10:30. That's when I eat something. have a coffee, eat some fruit, toast, whatever. And then I tend to get hungry again around 2:30, and then in the evening. I know it's not normal and regular for our, in our society, it's usually morning, noon, night, 8 a.m., 12 p.m., but it doesn't matter. So for me, I just keep that regular schedule. It works for me and keeps me happy. So whatever it is your schedule is, just try to keep it, okay? If your day is going to be different than a usual routine day, pack some food. Okay, pack food, pack water with you, carry it in your purse, and that will definitely help you avoid those triggers. Sleep deprivation. So it's not just about getting enough sleep. Enough sleep is really important. It's important for everybody. But the same as with your meals. Keep the same, or to the extent possible, the same routine. If your bedtime is 10 o'clock, 11 o'clock, whatever it is, but stay consistent. That's the more important point, okay? And stress levels. So stress doesn't necessarily cause a seizure, but it can, again, be something that is a trigger for you, okay, when you're taking everything into consideration. So, and then there's, different life events. Life happens. COVID has happened. We'll talk more about that later. Just different things. How life is not, simple. It's not straightforward. So whatever you can do to protect yourself, maintain your own kind of internal routine, the better off you will be. And again, to the extent possible. No one's perfect. Except for maybe my kids. All right, what are some life events? Age. As we grow older, as we go through life, bodies change, neurochemistry changes. So because you were perfectly well controlled, even like something like migraines, well controlled at this point in your life may not be well controlled later. Same with epilepsy, same with seizures, okay? Other medical conditions that we may develop can impact. Surgery, that's a big life event. It's a stressor on the body. Your schedule gets disrupted, so that's something to, you take extra precautions during those times. And pregnancy, right? That's a huge change in the physiology of a body. And so we just need to talk about how to keep you safe. So when I talk about age, brain and body change with age, your potential for seizures and the seizure frequency. And so really important, seizure control throughout your life. It promotes health and longevity, okay? Medical conditions, just a quick list. This is by no means comprehensive. Women in epilepsy, we just touch on this a little bit. Women have throughout our reproductive lives the menstrual cycle. There's different hormonal levels, and those may impact seizure frequency. Some women have what's referred to as catamenial epilepsy, which is linked to the menstrual cycle, different hormones at different particular points in the cycle. They will have seizures, so that's important. That's where the calendar comes in really important, because it can help your doctor identify if you do have catamenial epilepsy, and there's certain medications that actually work better for this type of epilepsy. So that's, a really good example. Pregnancy, menopause, against hormonal changes. With pregnancy, your volume changes, so medications may need to be adjusted. And there's hormone replacement, right? So again, seizure diary really helps with these issues. Epilepsy requires continuous treatment throughout the pregnancy. Uncontrolled seizures affect the mom, and they can affect the baby. But most importantly, you, the mom, you're my patient, right? And so my focus is on you, even though sometimes I know we do care about the fetus, obviously. But if I take care of you and your epilepsy is optimally controlled, your fetus is going to be fine. Advanced planning with your doctor promotes the best outcomes. So months before you decide you're actually going to go for it, get pregnant, it's really a great idea to come in, talk with your doc, if there's medication changes that need to be made, any questions that you have, that's what we're here for. Okay, closer follow-up with your doctor during pregnancy and post-pregnancy are also very important. And then often, unfortunately, we will get people who have decided, I'm pregnant, I have stopped taking my medication, I was afraid it was going to hurt the baby. And it really oftentimes is due to misinformation or misconceptions, fears. I get it. I absolutely understand. But you may not have to do that. There's so many options now. We have lots of medications. We have a few that are absolutely safe in pregnancy, and just come in and talk to your doctor. Really super important, okay? You healthy means baby healthy. So, epilepsy and COVID. I know everyone's wondering about this. So, at the present time, a medical history of epilepsy, so you have epilepsy, you have seizures, has not been reported to be a risk factor for developing COVID-19. So you have the exact same risk of getting COVID that you would if you did not have epilepsy. So if you are a person with other risk factors for getting COVID, you still have those risk factors, but epilepsy does not apport you an increased risk factor. So that's as far as we know. So that's good news for you. One thing to keep in mind though, COVID-19, it's a viral infection. You may have fever. Fever is another one of those known potential seizure triggers. So if you feel sick, have a fever, take your Tylenol, take care of that. And hopefully it won't cause you to have breakthrough seizures. So fever, stay hydrated, please. Don't miss your meds. Please do not miss your seizure medications, because these do put you at risk. This type of thing does put you at risk for breakthrough seizures, okay? So what's my big message? Don't delay care. If you have a change in your seizures, if you have breakthrough seizures, or for whatever reason, just don't delay. Come in. Never run out of your medications. This is hugely important. I know things are rough right now. Find out if your pharmacy does mail order. Find out if they have a delivery option for you. Send family members. Just make sure they mask up, wash their hands a ton, and send somebody to get your medications, but please don't run out. And we're here for you. This is what we do. Whatever you need, we're here. And that's it. So I'm going to look at my phone because I think there's some questions that have been asked. Okay, let's see. Oh, not that one. There you go. Okay. Can gene or DNA testing show higher chances for epilepsy in offspring? The answer is it can. There are some very well documented genetic syndromes that include epilepsy. Some of them are hereditary, so parent to offspring, and some of them are not. They can occur spontaneously. So again, this is something that you would have to talk to a genetic counselor about, get genetic testing, or your child, your offspring may need, if they're going to a children's hospital, if they started having spells, one of the very first things that will happen is they get genetic testing. So yes, very important question. Next. Have you heard of DTM treatment for depression and anxiety? Have you ever heard of side effects triggering seizures for this treatment for someone who never had a seizure before? I don't know what you mean by DTM, so text us again, and then I'll answer it, okay? Okay, let's see. My son was aware of both gradual seizures. Now he has PTSD. He's afraid of having another one. He also has anxiety. Yes, this is very, very common, and like I was talking about, epilepsy is an entire condition of the person. So, it's not a one-person show. When you come in, like I said, there's different resources. So oftentimes my patients will get referred to psychiatry. There's no shame in that. A psychiatrist often is a very close partner of mine in trying to address some of these symptoms of PTSD. There's other medications. Sometimes certain epilepsy medications can also function for mood stabilization, and some do not. So again, perhaps there's medication adjustments we need to make. But you're not alone. There's different options, different resources, and it's just going to be need a lot of patience. It's going to be a work in progress. These are really tough questions, and they are not solved in one visit, unfortunately. I wish I had my magic wand. But there's hope, and like I said, just come in to see your doctor. Next, do children really grow out of generalized seizure disorder? Okay, so yes and no. It depends on the epilepsy type. It depends on if there's a genetic predisposition. There's many types of generalized epilepsies, and it depends on your child, and it depends on the type of epilepsy. Very important that your child get linked in with a pediatric epileptologist, a pediatric neurologist. I'm an adult neurologist. I do not know all the answers. I'm not, trained specifically for kids, but I have lots of acquaintances that I work with, and so I would recognize that and strongly encourage you to take your child to see a pediatric neurologist, a pediatric epilepsy doc. Okay. All right. Why is there risk of having seizure after a stroke? What can you do to prevent this? Well, the short answer, try not to have a stroke. That's silly because at this point you probably already had one. But so this is my spiel for stroke prevention. Exercise, exercise, exercise. Do what you can to avoid obesity. Don't smoke. No excessive drinking. Absolutely zero drugs, please. And but if you have had a stroke, the reason that seizures occur post-stroke is, like we were talking about at the very beginning, what is a seizure? A seizure is an unregulated firing of your neurons. In a healthy brain, neurons regulate each other. There's different chemicals that go into the very wonderful balance that we have in our brain. Stroke happens and neurons are destroyed. They die. Neuronal pathways, so different ways that neurons spoke to each other and regulated each other, may have been damaged. And so you may develop cortex or groups of neurons that now don't have a regulation on them. And so they will misfire or they will fire without regulation. That is a seizure. And that's why stroke can increase your risk of developing epilepsy. Is there anything you can do to prevent it? Unfortunately, at this point in our technology, in our medical technology, we don't have a way to prevent post-stroke epilepsy. Not everybody develops it, but unfortunately, we don't have a way. Putting a pre or prophylactic medications has not been proven to be helpful. If you're going to develop epilepsy, it happens no matter what. Okay, so the best thing is to stay healthy, try to prevent strokes in the first place. If you have had a stroke, talk to your doctor about secondary stroke prevention and do what that person tells you to do, please. Okay, so more questions. Let's see. Deep transcranial magnetic stimulation. I haven't heard of that, so I don't have any answers for you. I'm sorry. Let's see, any more questions? Can seizures be cured? Yes and no. Epilepsy is a very complex condition, just like the brain is. When I talk about the brain, to me it's like, the ocean or outer space. We know a ton about it, but I kind of feel like we don't know the half. And that's what makes it so exciting and interesting. The downside is that at this point in our medical technological history, we do have some really great treatments. So some forms of epilepsy can be cured. and some cannot. But there's a lot we can do. Even if we can't, quote unquote, cure it, there is a lot we can do. Different medications in our armamentarium. There are different surgical procedures, different things that implants that we can do. So if you are interested in really kind of getting more information about your particular type of epilepsy or the epilepsy of your loved one, what you really need to do is go to your neurologist and find out, does that neurologist have an epilepsy center? So surgical procedures really should only be done at places that have a multidisciplinary epilepsy program. So if your particular doctor doesn't have that at their disposal, they will be able to refer you to a center. It doesn't mean you're walking away from your doctor. It just means that your doctor is going to work in conjunction with that team, and you'll get to know, you'll probably undergo more testing and figure out what your best options are. Okay, let's see, any other questions? I don't see any. Okay, what do I do if someone has a seizure and bites their tongue? Should they go to the ER? So I say go to the ER anytime you are uncomfortable. You know, some people, it's just part of their lives. They will have a seizure. They've done it their whole life. Their doctor said this is kind of the best we can do. And you know your family person, you know your patient the best. If that patient then goes about their day, they don't necessarily need to come to the ED. I always say if a seizure lasts more than 5 minutes, if they have multiple seizures in a row without regaining consciousness, or without kind of breaking that cycle, I'd say it's a good idea. The mere biting of your tongue, I mean, usually they don't need stitches, it's just going to be sore. So a tongue bite isn't necessarily the reason. The reason would be if that patient doesn't usually have generalized seizures, maybe they only have small focal seizures, maybe something else is happening. So it might be a good idea. But you as the patient or you as the caregiver or family member really has to make that determination whether or not to call 911 or not. It never hurts to get your patient or your family member checked out. Maybe they just go home later, okay? But you'll just have to make that determination at home. Let's see, anything else? Can seizures cause bipolar disorder or vice versa? It's not really a cause and effect. These two conditions seem to correlate. So persons with epilepsy are at increased risk of developing mental health disorders, but it's not a cause. And vice versa, persons with mental health illness have a higher risk for developing seizure. We don't know why. I can tell you my hypothesis, the mind lives in the brain. If something's wrong with the brain, the mind is not going to be happy either. But those are, I don't know how else to explain that. It's just they are a correlate of each other. Okay, so I think my time is up today. Again, we're here for you. Don't delay care. Have a wonderful, wonderful day, and stay safe. Mask over the nose, please. Lots of hand washing. Thank you.